for my post, I'm talking about the difficulties of a terminal prognosis, which is essentially the difficulties of deciding who should be considered or counted as terminally ill, and whether or not the criteria for permitting physician-assisted suicide is attainable. Um, this little article talks about how, under Oregon law, the request for physician-assisted suicide is valid only if two physicians in the state of Oregon state that a patient has a terminal disease that is incurable and irreversible, and that the patient will, within reasonable medical judgment, produce death within 6 months. Now, under Oregon law, the Oregon Health Authority interprets terminal to include conditions that can be reversed or even cured, but that will likely lead to death in 6 months if not treated. Now, if treatment is refused by the patient or withheld by others, such as the physician, the insurance company, the government agency, that makes the treatable condition terminal because treatment is being withheld. So that would then qualify a patient to be prescribed lethal drugs for physician-assisted suicide. However, that also expands to Oregon Health Authority also expands the definition of terminal to cover patients who could have lived for decades with treatment. To me, that doesn't really make sense because incurable and reversible does not mean terminal. Terminal is a definitive patient will die. There's, you know, I guess not necessarily nothing that we can do about it, but terminal to me is the patient will die. I understand why they're saying terminal could also be, something that could be cured with medication, but if they're saying that it's incurable but also curable with medication, I'm getting a little confused about that. Then it goes into talking about palliative care at the University of Virginia Medical School, and how long, being able to predict how long somebody has to live, being imprecise in most conditions, because most people die of things like cancer, heart disease, lung disease, dementia, which makes up 87% of cases that qualify for lethal drugs in Oregon under Oregon law. So determining what qualifies and what the criteria is for physician-assisted suicide is tricky. I agree that it's